Destination Medicine is a joint project of the regional training hubs. This podcast series brings you medical students' accounts of their experiences in applying to study medicine.
Welcome to Destination Medicine. I'm Nicole Goodman. Dr. Yvonne Chang, a first-year intern at Tamworth Hospital in New South Wales, took an indirect path to medicine. Starting off by studying agricultural research, she decided a lonely life in the lab didn't suit her. She wanted more personal interactions and to help people. And her rural placements, certainly in Broken Hill, cemented her love of the country and her desire to work in regional and rural Australia. So, braving the GAMSAT, she started on a journey that has taken her to Tamworth Hospital. Yvonne Chang starts by explaining to Jeff Waters why it is that she chose to study medicine.
So I think I probably decided to be a doctor later than most people. So I went to school in Sydney and did uni there too, but didn't think that I wanted to be a doctor at the time, just because I had lots of really great friends who went into medicine and I thought they'd make a really good doctors and I probably wouldn't really make a big difference by doing medicine. So I went and did some other things. I worked in ecology and ag for a couple of years, and as part of that started travelling around Australia. One of the stops I had was living in Narrabri, and I thought it was probably one of the most formative experiences I had, and I really got to see firsthand the impact good health care professionals have in rural Australia, and I think I really appreciated the difference that it makes for people to have people there locally in terms of travelling and their access to healthcare. So kind of at that stage, I decided I really wanted to change from my research career and decided to move into medicine and maybe end up in a rural area, hopefully.
So you went to medicine through studying agriculture, is that right?
Yeah, that was one of my second jobs. It was in ag research.
So you did consider other careers?
I did, yeah.
But decided on medicine. Why?
Yeah, I loved research. I loved it because I just got to learn and keep learning all the time and was surrounded by people who are really keen to learn. But I realised I was just much more motivated by people and just being able to see and make a difference in people's lives in a really, little ways and big ways. And medicine seemed to tick both the people thing and also the continuing to be interesting and always having to learn. So studying forever and people forever, that seems to be a good combination.
So when you decided to be a doctor, who did you tell and what was their reaction?
Yeah, I talked to a few people. I talked to my boss in ag, who was really great. We've been chatting about 5 and 10 year plans at work, and I probably think more of along a 6-month to 1 year plan at most. But he said to me that I should probably think about either doing a PhD or doing something else that would challenge me. And I realised I didn't want to do a PhD, and so I had to think really hard about that. And so when I told him I was thinking of doing medicine, he was just like, yep, go ahead. That sounds like a good idea. I talked to friends who are already doctors, and that was really helpful because that gave me a really realistic picture about the really lovely and good things about it, but also the really hard things that come with doing medicine. And gosh, I talked to friends who knew me for a long time to think whether that was a good fit or not. And then I probably told my family last because I didn't want to tell them until I was sure. So yeah, they were pretty stoked at the end.
When you decided to apply for medicine, what were your first steps and did you map out a plan?
I kind of had to work out the steps to do medicine. So I think just working out, for me, I went through the postgraduate route. So knowing that I had to sit the GAMSAT entry exam and then knowing that I'd probably have an interview. But apart from that, and knowing that I had to study, I just had to fit it around work, really. So the exams came in the middle of the cotton season, which for me at the time was our busiest time of year. And so I just made sure I stopped, did a bit of study, which was really exciting. It was nice to just get back into the chemistry and physics a little bit that I'd left behind. And then just did that in the mornings and then went and chatted with friends in the afternoon. So it was not too onerous at the time. And yeah, that's probably not a very helpful answer, Jeff, sorry.
No, of course it is. Did you have a plan B if you didn't get into medicine?
I'd been thinking about whether to do something like ecological or environmental consulting, things like that, but something where there was a lot of people and where I'd be learning a lot. Probably should have had a bigger plan B, but I didn't. I did take a year off to work in admin for a little bit in the hospital, and I think that was really helpful. It just gave me a different perspective of what the hospital environment was like, in a way that you experience different to being a student there and different from being a doctor. So I think actually that was a really valuable experience for me and kind of made me a bit more sure that I wanted to do medicine.
Terrific. What tips can you give our audience about the application or the selection process?
I think the main thing is, one, knowing all your cut-off dates. So just being sure. At the time when I applied, there was like 2 different unis or groups I applied for, and they both had a very firm cut-off date. So knowing when everything had to be done by and being organised to get that done. And I think also I found it really helpful just to be honest when I had my interview. Like, for me, it felt like a chat, and I felt like I just got to know what I thought a bit better as well as the other people. So I think just to be yourself and be relaxed in your interview, to try to enjoy the process of doing the exam, which I know is really awful. It's a very long day if you're doing it the postgraduate entry exam, but it really helped just to enjoy it, to take time out, just try to make it as fun as possible.
So since then you've had some clinical placements. Where did you go and why did you go there?
Yeah, so at the moment I'm working as an intern, so I've just finished uni. And during med school, I had really lovely opportunities to do some rural placements. And I think that was helpful to solidify my decisions to work rurally. So I got to spend a year out in Broken Hill, which is in the very far west of New South Wales. And I absolutely loved it there. It's a small hospital, 70 beds, I think, and staffed by both a mixture of a handful of long-term doctors and also quite a number of locums. And that was just a really lovely experience to see the rural hospital, the challenges that come with it, but also the really lovely community that surrounds you.
Tell us more about the community experience. What was that like?
Yeah, I really loved it. I think as a student, there's just a great privilege in having other students there and also having lots of the other junior medical staff, nursing, allied health. We all lived sort of close to each other and everyone was really keen to just try new things and explore Broken Hill and the surrounds. And I think I just spent a lot of time getting to know people, doing things like the girls I lived with, before COVID, got involved in like the netball team and I got roped into the touch footy team in week 1. I joined a choir, my housemate joined the band. We just really wanted to be part of the community while we were there, and people were just super welcoming of us. And then even within the hospital, people were just really keen to get to know each other. We were keen to invite people into our homes as we could with COVID restrictions. And that was just a really lovely year to just be around people and to learn in that environment.
That sounds like a lovely experience. Now, a bit more seriously, a lot of people in medicine experience what's called imposter syndrome. What is that and how do you deal with it?
Yeah, I think often at times myself and others feel like we don't really know what we're doing, and that happens sometimes as a student and sometimes even as I'm working. I think, what am I doing here? Do I know what I'm doing? I think for me what's been really helpful is a number of things. I think first of all, I guess I have a faith as a Christian, and that has been really helpful. It's reminded me that I guess I'm not in control of everything and that I don't have all the answers, but it's also reminded me that there's no kind of shame in kind of asking for help and seeking things and learning. And so I guess that my faith's been really helpful in grounding and reminding me that I'm not just an imposter. And I think the second thing is having a really lovely community around me, both my supervisors at the hospital and mentors and also just colleagues and peers who most of them are really happy to have you ask questions. Most of people are really happy for you to just say, I need help. If you're keen and willing to learn and improve, people help you out. And I think knowing that your peers maybe also go through the same thing has also been a real help as we've encouraged each other as we go through studies. Yeah, those things have kind of helped with the imposter syndrome. I don't think it ever goes away. There are some days I go, oh my goodness. But yeah, those three things.
What is it about medicine that you could never prepare for?
I think it's like most things. People talk about medicine as being an art and a science. So at uni, you can learn lots of facts or, best evidence-based medicine, but nothing really prepares you for just dealing with people. I think in the real privilege it is to have conversations that are really honest sometimes, or the emotions that come as people are in hard decisions. Yeah, I think nothing really prepares you for it, but it's also one of the joys and privileges that makes medicine really exciting. I think that's the biggest thing you can't prepare for.
Dr. Yvonne Chang, first-year intern at Tamworth Hospital in New South Wales. We trust you've enjoyed this episode of Destination Medicine, a joint project of the regional training hubs. The hubs are supported by funding from the Australian Government under the Rural Health Multidisciplinary Training Program.